Last week on May 4th, 2017, the House of Representatives, Congress, passed a bill that has been in the news a ton and affects what I do and your life too, potentially, because we all need health care. And this bill is called the American Health Care Act, or AHCA. And it is an attempt to repeal the Affordable Care Act, or Obamacare. Right now, the bill has just passed Congress. It's now going to the Senate. If the Senate passes it, which we don't know if they will or not, but if the Senate passes it, what would happen next is the Senate and House bills would get reconciled into one law. They would both need to pass those bills again, and then it would go to the president's desk for signing. The current president has assured us that he will sign the bill if it is passed. So this is very likely something you should be paying attention to and be well informed about. So this video is an attempt to just give you some pieces of information that are relevant to you that could potentially affect you, so you can make a decision about whether you support the bill or not, and whether you contact your senators to voice your support or lack thereof. So the first thing that I think is the most important is this pre-existing condition waiver that the bill allows. So right now, under the Affordable Care Act, or Obamacare, insurance companies for individual and family insurance, and employer groups can't discriminate based on pre-existing conditions. That means that a 30-year-old in my zip code with no health problems at all, and another 30-year-old in the same zip code with very severe condition can't be charged different rates for the plans. Those two people are charged the exact same rates. So what the American Health Care Act bill is attempting to do is change it so that federal law no longer has those restrictions against pre-existing condition limitations, and sending it back to the state. Republicans are saying that this will allow for better state control, which is true, certainly, but it should be up to you as to whether or not that's a good thing. Before the Affordable Care Act, most states did allow pre-existing condition limitations, and I suspect that most states would go back and allow them. The governor of Wisconsin early last week said that he would, in fact, allow companies to discriminate based on pre-existing conditions. He's now walked that back a bit, but given his administration's policy before the Affordable Care Act came out, I suspect at some point they would allow some sort of pre-existing condition limitations, the depth of which we can't be sure, and that will go through a whole legislative process. But the short end about the pre-existing conditions that you're hearing in the news is that, yes, it's quite possible that if this bill does become law, companies in Wisconsin will be allowed to deny people or reduce coverage based on pre-existing conditions. Not certain, but based on previous history, I suspect that Wisconsin would indeed allow this. So this pre-existing condition waiver in the American Health Care Act just lets states pick whether or not they're going to do it. So there may be some states that don't allow pre-existing condition waivers that the state has. Some states will decide to do it. We're not sure which and the extent to which they'll do it. We do know that the law would allow certain conditions to no longer be covered. Insurance companies would get to choose how much they cover. So for an example, the Affordable Care Act mandates that maternity care is covered by all plans that qualify as full health insurance with essential health benefits. So potentially with this new law, an insurance company or a state, if they wanted to regulate it, could decide whether or not they cover something like maternity care. I can tell you that before the Affordable Care Act, companies were regularly not covering maternity care, especially for individual insurance. Most group plans did cover it, but people who bought individual insurance often didn't have maternity care. Mental health care is also a big one. Our state, Wisconsin, allowed mental health care to just not be covered. So that's one of the big points, and that's what people are really talking about, this pre-existing condition concerns that we have. Check out the rest of our videos for more tips on other parts of this potential bill so you can better inform yourself. Thank you.